Hello guys, welcome back to Dr. Arshad Nadeem Awan ultrasound and radiology teaching videos. Hope you're all doing well and you're enjoying your life. With respect to renal system, today my topic is acquired renal cystic disease. Acquired renal cystic disease, as the name shows, that it is not congenital, like in case of polycystic kidney disease, adult polycystic kidney disease, which happens to be congenital. This is actually acquired, and in acquired renal cystic disease, the kidneys happens to be either small in size or maybe normal in size. This is the criteria which makes it distinguishable from the adult polycystic kidney disease. The another important point worth noting here is that it's in 30% cases this renal cyst occurs within chronic renal disease. And those who have been on dialysis after 5 years, 90% patients develops acquired renal cystic disease. And the one hallmark is that these cysts are prone to develop the renal cell carcinoma. So therefore, keep eye on that. Those who are been through the dialysis, you should regularly monitor their kidneys for the development of any cyst. So this is called as acquired renal cystic disease, as it is acquired. How we can appreciate on the ultrasound imaging how it will look like? It will normally look like the cyst you normally see on the as a serous cyst, or you might see in some other forms. But the main criteria is the history, and there will be history of the chronic renal disease. There will be history of dialysis. So these 2 points are worth noting. And the second thing is the kidney of the patients would be either small in size or large in size, as I mentioned earlier, that which make its differentiated, makes it different from the adult polycystic kidney disease, is that in adult polycystic kidney disease the kidney would be enlarged in size. So let's start watching these imaging, and hope you will pay attention to the history of the patients, and also you focus on the radiologically imaging, particularly ultrasound and CT images. So let's start watching images for the acquired cystic renal disease. On these transabdominal images on the both side, you can appreciate that this is acquired cystic kidney disease. So how we can appreciate that? Because the cyst will look similar to the other cyst. The one main important feature is that the kidney would be either small or normal in size, and the second thing is there may be some kidney disease or existing chronic renal disease. So in this case you can appreciate that the kidney sizes are small and there are multiple developing cysts. So its GFR was reduced, and its creatinine and urea were high. So that's why they were labeled as a chronic kidney disease with multiple cysts within it. Another example of the acquired cystic kidney disease, here on these 4 images you can appreciate that the kidney is normal in size, and you can see there are multiple developing cysts within its parenchyma. So this patient was put on the peritoneal dialysis, and after peritoneal dialysis with the span of 4 years, patients developed the cyst, and this were considered as an acquired cystic disease. The one problem and the hallmark with acquired cystic kidney disease is it's prone to development of the renal cell carcinoma. Another example of acquired cystic kidney disease in chronic renal failure, in chronic renal disease, here you can appreciate that the corticomedullary differentiation is lost, and this is a particular case of a chronic kidney disease. You can appreciate there are multiple developing cysts, and you should have to be very careful, put the patients on the surveillance scan, because these cysts are prone to develop a renal cell carcinoma. And as I mentioned, that there is 2 major reasons for the developing of the acquired cystic kidney disease. The one is the patient will be having on the dialysis, or the second patient must be having a chronic renal disease. Another spectrum of the disease, acquired cystic kidney disease. Here you can see that the echogenicity of the kidney is increased, kidney is small in size, and beside this there is loss of corticomedullary differentiation. This is the renal parenchymal disease, I would say grade 3. And within this kidney you can see there is a development of cysts. So these cysts are prone to developing the renal cell carcinoma, so it needs focus, it needs to be it needs to be having attention pad, just to be on the safe side that they might develop the renal cell carcinoma. Well, the another example, that's for the chronic renal disease. This is a grade 3 renal parenchymal disease, because you can appreciate that the corticomedullary differentiation is lost, kidney parenchyma is echogenic, kidney size is small, and beside this you can appreciate that there are multiple developing cysts which are prone to develop the renal cell carcinoma eventually. So for that condition you have to have the surveillance scan to keep eye on, and just write the report if there is any further progression in the development of the cysts or not.